How has COVID-19 affected you, your family, and your community?
COVID has affected my family in a lot of ways. We've had to figure out how we were going to get the vaccine, because in the beginning it was very difficult to get. It affected us in our health, having to be very concerned about my mom and her conditions and other people in the community. And I work in a school, so it affected my whole life. Still affects everything I do because I work in a high school. With the policy changes, all of a sudden school was shut down in a day, so we were home.
Yeah.
So it's a concern, even with the vaccine, without the vaccine. Maybe it's more of a concern because you don't know how long we're going to keep getting it and how many people are willing to get the vaccine, because you've seen a drop off. Initially, people wanted it, and now that everybody's getting it, people aren't interested and they don't believe that the vaccine works. So that's a concern.
Okay. Have you been vaccinated for COVID-19, or do you have plans to be vaccinated?
Yes, I'm vaccinated, boosted.
What were your reasons for doing so, and have your views about the vaccine changed? What was your experience getting the vaccine like, from making an appointment to receiving it?
No, I never had any questions about getting it, the vaccine. I'm a nurse, so I was able to get it through the health department. I was able to get it. Actually, it's been exactly 2 years, because I got it as soon as the Ocean County had it. I got it on Christmas Eve in 2020, because I was doing COVID testing for the health department prior to the vaccine. We did COVID testing at a local college, so all the nurses that participated in that were able to get the vaccine if they wanted it. So there wasn't never a doubt that I was going to get it. I believe in immunizations because I work in a high school. I believe that they protect and they prevent disease. I know there was a lot of difficulties in the beginning when it first came out. It was just because of the supply was much more than the demand was more than the supply. And it was just because the state only allocated and the companies can only allocate because there was freezing. There's a lot of issues with storage and how the health departments were going to manage it. But once everything started and the coordination and the supplies came in, it got to be much better, because then once we were able to get the vaccine, then we started administering it. So I went from COVID testing to administering the vaccine. So it was a very efficient program that they had to know how much supplies they had, because they had to keep it in the cooler, and they only allocate so much. So you could only have so many people register. So I know that was a big issue, because people said that the computer shut down, the state website wasn't always available and initially, but it was something that they'll have to improve for next time, how to make it more accessible and so it doesn't shut down on people. And there was lines and lines and lines, so it was very hard because we only had so many, so you had to turn people away if they didn't have an appointment. So it was a learning strategy for the local health departments, but it was such a rewarding experience. I miss doing that program.
Distributing vaccines.
Yes, I do. It was a wonderful experience, from doing the testing to administering to seeing people feel better and safe and go back to their lives and visit their kids and everything. So it was very rewarding. And I was able to help my family too. I was able to get my mom to get a vaccine because I worked for the health department, and they allowed, if they had extra vaccines, I was able to bring my mother in, and I was able to bring my daughter in. So that was a good positive perk of being part of the health department.
Yeah. Okay. Thank you. Who or where did you go to for information about the COVID-19 vaccine, or what sources did you trust?
Because I'm a nurse, I always went to the CDC, and I always got because I was working for the health department as a seasonal nurse, everything was current. I mean, anytime, every weekend that I did the vaccines, they gave updates on the vaccines, whether, because sometimes there was like different guidelines, if you on antibiotics, if you're on certain medications, if you had this condition, they said you had to wait a couple weeks. So every weekend that I went there, we've got a briefing on any updates on the vaccine, the Pfizer and the Moderna and the J&J. So
Okay.
we got updates from the health department, the state, and the CDC. That's where I went to, no other sites.
And you obviously tested.
Yes, I didn't, those are the sites that the CDC, the New Jersey Department of Health, and our local health department. That's how it went down, from the CDC to the health department to the local, and then they distribute that to the community. And that's what we did in the schools too. That's how I tell everybody to go to the CDC first.
Okay. Are COVID-19 vaccines available in your community? If not, what are some barriers or challenges to getting the vaccine presently? Or during its height?
Well, it was available. I mean, there was a lot of pharmacies that initially it was only offered through the health departments and different mega sites. That's what they did. I guess that's because they wanted to get as many people vaccinated as possible. And I believe that worked. It was just hard for people to travel and to get to those places and to get those appointments. But now, I mean, all pharmacies offer it. You can just go anywhere and get it. So I think most local pharmacies offer the boosters. And the appointments you just have to do it online, I think are more accessible. And I just wanted, with the health department, they still offer people that are homeless or people that can't get appointments, they go to the house, and they did homebound visits to people that weren't able to go and get the vaccine. They went to the house, they went to the communities and did the vaccines. They did local libraries. So it's all open now.
Went to people's houses
paid, nurses.
Okay.
I don't know if they were volunteers, but they go to people in the homeless and people that were homebound, that can't get out. They were able to get the vaccine if they called the health department and made an appointment. It's a mobile unit they have. It's a mobile.
How would you say that, like, the health department made that like option of like known that they did that?
Well, they advertised on their site. I believe they probably went through the social services, the Ocean County Social Services. They probably advertised through that. They offered through Pie Senior Centers, local veterans centers, the libraries. They advertised all over for that. I'm sure a lot of it went through the county's social services, people that got Medicaid, people that were on programs that the seniors, people that were homebound are on. That's how they reached out to them, to the organizations that work with seniors and disability people. Yeah, they reached out to those organizations. So,
okay. Would you say it is easy to get the COVID-19 vaccine?
Yes, today, now in the last year, I would say the first 6 months from when it came out in December 2020 until that summer, it was more difficult to get. And that was only because people were panicked and they didn't know, and so many people were dying and nobody wanted to be in the hospital, and all the news stuff about the vents and everybody not surviving. But I think it took about 6 months. I would say from the December to the summer, it was more accessible. Anybody was able to get it. I believe by May, the governor said, because at first you had to follow those guidelines.
May 2022.
Yeah.
Okay. So how do you think state or local organizations could contribute so more people could have confidence in access to the vaccine?
I think they just have to keep doing what we're doing, advertising. It's very hard to change somebody's mind, to do the hesitancy. You just have to listen to them and just give them the facts and let them make their decision. You're not going to be able to change anybody's mind. It's unfortunate. But you just have to provide, this is what it does, this is what it will do, and just let them make the decision. You can't try and give your opinion. You can only give the facts. You only tell them, like I said, go to the Center for Disease Control website, look at the facts, and just try and listen to what they're concerned about, and just try and say, this is what it is. This is what's in the vaccine. This is what it will do, and help them to make their decision. It's very hard to be non-judgmental, and so you just have to give them listen and provide them the information and just have them make the best decision.
Well, from your personal perspective, do you have any ideas of things that the state could do differently to try and improve the access or hesitancy? Just your personal thoughts.
No, I believe, I mean, I do a lot of webinars. I do a lot with the pediatrics, the New Jersey Immunization Network. They do programs on hesitancy for pediatricians. They did all these programs prior to the vaccine becoming available to kids. They did all this skills and teaching to the pediatricians so that when parents came in, the pediatricians were prepared. So, I mean, I think they did the best that they could, and they're still doing it. They're still advertising on the TV and on the radio about, you want to go visit your grandkids, this is the best thing for you.
So you think targeting their heartstrings kind of is a good approach?
Yes, targeting the things that mattered most, the visiting, traveling, doing family, that's what people want to do.
Their values.
Yes. So I think they still do it. I mean, they did a lot of prep for the doctors, as far as I can, because I participate in a lot of programs, and a lot of it was geared towards pediatricians dealing with the hesitancy issue. So I think they did okay. They seem to, they're improving. I think the advertising, they haven't stopped. They still do the advertising for the boosters, so they're not giving up.
Okay. So this kind of touched on the last question, but local and state health departments improving upon communications and messaging about the vaccine. And touched on tugging on people's family values, their personal values, what they think is important, which is family.
Traveling, visiting, having dinners together, gatherings,
going out and socializing.
Yes, that's what people want, and that's what will get the people vaccinated. So. And I think just what they're doing, they're continuing to going out, they do the homebound, they do libraries still, they do all that programs is what health departments are, government agencies, they're supposed to do, and that's what they're doing.
Yeah.
Ocean County.
Have you had the opportunity to talk to a healthcare provider about the COVID-19 vaccine?
Yes.
Okay.
Well, because I work in a school. I am a healthcare provider, so yes, but with my school nurses, we had lots of meetings. We still talk about it because we had to, because there's so many changes. Every week there were new changes coming from the Department of Health about guidelines and policies and updates and what we're doing in the schools, outbreaks, how to report it, when to report it, what we report, the contact tracing. That's a whole nother issue that I participated into. I did contact tracing. Before I did the COVID testing, I did contact tracing for the health department. And for the school, for the past 2 years, that's all we did was contact tracing. If someone had COVID, you had to go and see who they had contact with.
Okay.
So.
Second to last question. Do you think all communities in New Jersey have been given equal access or information to the vaccine? If not, who has been left out?
As far as I can tell, I mean, Ocean County seems to have been participated in. I can only say for that. And no, I don't think anybody's been left out. I think it was a state initiative. I think the sites that they opened when the vaccine first came out, I think they tried to do South Jersey, North Jersey, Central Jersey, so that everybody has accessibility. I think all the health departments were able to get, it's hard to say who got the most. I think it was just, I think it was distributed how they could distribute it. I think they did, as far as I can tell, an okay, efficient job.
Okay. Is there anything else that I haven't asked you that you would like to share?
No, I just felt very good that I was able to do something with the COVID, the COVID-19, the pandemic. I felt very good when I did the COVID testing. People came up and you did the drive-through, and people were very concerned about passing it on, about their work policies. And then that was a very good experience that I was able to do. And then once we did the COVID, once the vaccine came out, that I was able to administer it. It was unfortunately, it was a good experience. It's not a positive condition or disease or the pandemic, but it certainly was, I felt that I contributed to helping control the outbreak. So that's it.
Thank you.